Hello everybody and welcome to PCR London Valves 2025. My name is Chris Allen and I'm joined today by Xavier Freixa from Barcelona in Spain. And we're talking left atrial appendage closure today, which is a new focus for the meeting this year, and we're very excited to have some results from a late-breaking clinical trial. Xavier, so could you please tell us about the study, but perhaps we start by the question that you were trying to answer.
Yeah, well, basically what we realized that, just most of the people were doing different things. Like after, of course, like the occlusion of the appendage. So some people were just doing to prevent DRTs or anticoagulants, some people were doing DAPT, some people were doing, maybe aspirin. So there was like a kind of a mess there. So we wanted just to put some, order there and just to try to know what's the best thing. And what we knew, from the beginning that maybe, the most common strategy was DAPT. Yes. So, and we kind of believed that maybe low-dose DOAC had something good just to bring, to the field.
Perfect, and that brings me on to my next question about the design. So a lot of variation in practice that you were trying to address. The population were patients undergoing left atrial appendage closure, of course, who had some contraindication to long-term anticoagulation. And tell us a bit more about the design of the study.
Well, basically, and actually the rationale of the study was that we start to use low-dose DOAC, for DRTs. And actually, it was very effective, and we didn't have any bleeding. So we thought, so if that's good for treating DRTs, so it's going to be even better, for preventing them. Yes. So since we didn't have and it was like a high-risk bleeding population, we didn't have any bleeding. So we thought, so why don't we assess that? And that's the rationale of the ADALA. So we compare after occlusion, so 3 months of low-dose DOAC versus 3 months of DAPT, followed by aspirin, like from month 3 to 1 year. So, and what we observed, it was like kind of surprising because, the composite endpoint was combined of prevention of DRTs and, of course, clinical thromboembolic events, but also major bleedings. So low-dose DOAC was associated with a lower rate of this composite endpoint. So actually we didn't see any DRT, while in the DAPT group we observed kind of 11% at 1 year of DRT. And talking about major bleeding, that it's kind of of the question, we observed that there was a trend towards lower bleedings with low-dose DOAC, major bleedings. Yeah. But if we analyze any bleeding, so there was significant difference. So low-dose DOAC was associated with a lower rate of bleedings compared to DAPT. So that was like kind of, the magical result, because we were like really stunned, by the difference. Yeah.
So signals on both sides of the line, both with respect to efficacy and safety in terms of bleeding.
Yeah.
And we all know that this is a very hot area at the moment. There are lots of studies around about the role of left atrial appendage closure and also the way in which we carry it out. Perhaps if I can ask you to set this study in that context, what are the implications of the results and the next direction for the field?
Yeah, well, so I'm not saying that, antithrombotic therapy, it's everything. I think that other, factors like device positioning and maybe, some anatomical factors like the size of the left atrium or, like the presence of echocontrast, mitral stenosis, I'm pretty sure that they play a role. But antithrombotic therapy, plays a role. And, coming, maybe that we've been all surprised by the results of the closure AF that have been, now recently, presented, not published. So we're waiting the publication just to look for the details. But what I understand from the trial, that according to the results, the therapy in terms of preventing ischemic strokes, it's good. So LAA, it's good. I mean, compared to medical treatment. So I mean, that's an important, step. But then the issue was with the major bleedings and the bleeding events. So what happened to closure AF, it was that, most or, the patients were taking DAPT. Yeah. So going back to the ADALA, if, that therapy would have been changed by, a more competitive, a more contemporary treatment like the low-dose DOAC, yes. I think that these results and that, weakness of the trial in terms of major bleeding could be compensated. So I think that there is a lot of room to improve, in that trial in terms of antithrombotic treatment. Sorry.
Brilliant. Well, what a great message to end on. Thank you so much for joining us. Well, there you have it. So in patients undergoing left atrial appendage closure, a strategy of limited low-dose anticoagulation with the DOAC versus DAPT was associated with improved safety and efficacy outcomes in this trial, which may have important implications on the design of future trials and also treatment of this important patient group. Thank you very much for joining us.